Hello, and welcome to Your Health Matters. I'm your host, Dr. Peter Hogenkamp, and today on the program, we are going to continue our series on healthy aging. For those of you who tuned into the last two programs, you'll remember that we've discussed in the first program the exercise habits that we should have to help us age successfully. And in last month's program, we talked about the other habits, such as spiritual habits, social habits, to help us age successfully. I want to remind us that aging successfully is not just living long. Certainly longevity is an integral part of aging successfully, but it's not the only thing. We want to live long, but we also want to live well. And we're going to talk about that today more. Today, we're talking about the dietary aspects of aging successfully. And to that end, I have the great pleasure of welcoming my colleague, Erin Jones, who is a registered dietitian at the Rutland Region Hospital. Erin, thanks for coming to the program.
Yeah, thanks for having me.
Really appreciate it.
Sure.
We were talking about food earlier as we warmed up for the session, and Erin was talking about, just how much focus that we have on food in our lives. We a lot of our budget to it. We a lot of our time to it. I mean, think about it: 3 meals plus snacks a day. Food has really become part of our culture in our social interactions. We go out to dinner with people, we have dinner as a family, so it's a large part of our lives. And so therefore, if we want to age successfully, we really should put some thought into how we eat and what we eat and that kind of thing. So I want us to just start off in general, Erin. When it comes to dietary approaches to living well, and really living well and successfully aging are really kind of go hand in hand, don't they?
Yes.
Give me your general approach on how you counsel patients to live well in terms of their diet and lifestyle.
Well, in general, when I'm counseling clients, I'm looking at the whole picture, the whole lifestyle arrangement.
Right.
Not just diet, but also we address exercise and we address sleep. We address stress management, and we also look at medications and supplements.
You sound like you're a family doctor.
Yeah. So oftentimes people think it's all just about the diet and weight loss, but it's looking at the whole picture, because that's how I help fix people and help them feel better. And that's a good point about improving the quality of life, not just improving the length.
Right. We want to live well, not just long.
Yes, correct. So I will emphasize that quite a bit with clients as well. But predominantly, I push, or I try to advise people on the basis of like a Mediterranean-themed way of eating. So
we hear a lot about, you hear Mediterranean diet all the time. But just for those of us who aren't familiar with it, and for me who is, give me some specifics on that.
So a Mediterranean-themed diet includes lots of fruits and vegetables, fresh or frozen, so kind of unlimited amounts of those usually.
Specifically fresh, frozen, not canned?
Correct. So canned vegetables tend to have a decent amount of sodium to them.
Right.
And so I really kind of try to stay to the frozen or fresh for people.
Good.
And then we look at a lot of using more fish instead of red meat. More lean, healthier proteins. And then we also look at nuts and seeds, such as almonds or pistachios or cashews. And then we do look at using olive oil as our basis.
As opposed to margarine or butter?
Yes, correct. So predominantly using healthy fats versus saturated fats. Tend to stay with
trans fats, yeah.
Yeah, or trans fats. And so that's kind of the basis of the Mediterranean diet.
So I've often, counsel my patients to use the Mediterranean diet, and the first thing they say is, "Oh, that's great because I love pasta."
Yeah, that's a big or a significant misconception.
Correct.
With pasta. It's if there is pasta involved, it's very portion controlled.
Portion controlled, exactly right.
And so what you're looking at. Typically, a kind of a standard American stereotypical diet of pasta is a big bowl of pasta with marinara sauce and lots of garlic bread.
With like 500 grams of carbohydrate in a serving.
Yep. Yeah. And so no really vegetables, no healthy proteins, no fiber in large quantities.
I always make the distinction between an Italian American diet and a true Italian diet.
Yes.
I've had the good fortune of spending a lot of time in Italy. I used to live over in Europe for 3 years, and I spent a lot of time in Italy, and I just love it there. But when you go to an Italian restaurant, there's just pasta is just a little serving of pasta as a first course, and then it goes on to the protein and vegetables.
Yes. Yeah, oftentimes I'm trying to at least 1 cup cooked of pasta or less, and then you're trying to fill half the plate with vegetables and then have a lean protein. And if you're still feeling hungry or not satisfied, I'd rather you have more vegetables or more of the protein.
Right. So we were talking earlier about numbers and quantity, and I think it's, when people first start like carb counting or looking at the weight of food or the calories in there, it's a little bit tricky, but it really isn't that hard, is it?
No, I mean, historically people look at calories and they say a calorie is a calorie, but it's not quite that. I tend to look at quality of the food, the quantity of the food, and the timing of the food, kind of those 3 things. And I'm kind of borrowing that from Dr. Kanosh.
You are.
Yes.
Dr. Kanosh talks about the standard American diet, which is to eat whatever you want, eat how much of whatever you want at whenever you want it. That's the standard American diet, and none of those things should be happening.
Yes, correct. Yep. So the quality. Now I'm forgetting the original question you asked me. I got sidetracked on the.
We were talking about just talking about in terms of counting numbers and calories and carbs, that kind of thing.
Yeah. So as far as so it's not all about the calories that we're counting. Some of my clients prefer to count calories, which is okay, but it's not about exact calories going in and exact calories going out. I usually try to get people to food journal, whether it's handwritten or using MyFitnessPal or an app.
Right, there's a lot of great apps for it.
Yep, so, and a lot of free apps, you don't have to pay for anything. And it can be a balance of carbohydrates, proteins, and fats. And you're trying to figure out what's best for this particular individual or this client based on for their food journaling. I think it's
because some of these dietary recommendations are going to be based on the patient's health history.
Yes, exactly.
For instance, if the patient has diabetes, you're obviously going to counsel them to have fewer carbs.
Yeah, and so the focus, on the and some people like to count carbohydrates versus the calories, and so sometimes we're taught going through school that 130 grams of carbohydrates is kind of the minimum, but usually I have clients do right around 100 grams of carbohydrates. It depends.
Per day.
Per day. And just to give you some perspective, like an Atkins-themed way of eating that most people are familiar with is 20 to 30 grams of carbohydrates a day.
Well, that's really low. For instance, your typical bagel, how many carbohydrates does a typical bagel have?
So, this one and Costco muffins are often perceived as healthy, and you can have anywhere from 60 to 80 to 100 grams of carbohydrates in those 2 items.
In other words, your entire day's worth of carbohydrate
could be in a bagel or a muffin.
Right.
Yeah.
And I explained that, and the sad part of this is that I love bagels.
Yeah. Yeah.
I just love them. But I use them as a treat, Every once in a while I'll get a bagel kind of thing, but in some of the sizes of some of these bagels, we went to New York recently, and we went down to this beautiful bakery and they had these bagels, and the thing was this big.
Yeah. Yeah, usually they're not as much fiber in those and not as much protein, and they're very carb dense.
They are carb dense. Yeah. Is there any protein in a bagel?
I mean, there's a negligible amount. Not enough to justify eating the bagel.
Right. Yeah. All right. So we're getting back to the Mediterranean diet, and let's talk about the oil part of that, because I think that's interesting.
Yep.
We've all heard that olive oil is good for us. Kind of go into that a little bit more.
So predominantly, this kind of standard American diet is high in omega-6s versus omega-3s. And really, omega-6s are the basis for more inflammation, and omega-3s help decrease inflammation. And so the Mediterranean diet with more fish and olive oil, it gives you more omega-3s, which is, you can also find this in flax seeds or chia seeds. And so using things like olive oil or having nuts and seeds like almonds or pistachios, or fish, which is high in omega-3s like salmon, or having...
Especially the darker fishes, the cold water fishes.
Yes, yep. Yeah. And then having fat come from like avocados, for example, or much healthier fats, and has been shown to help decrease total body inflammation, reduce chances of having a heart attack, heart disease, and reduce chances of having a stroke.
Yeah. So it's interesting, you were talking before about good calories. And I make that point all the time because things like cashews and pistachios and olive oil are not calorie poor.
Right, they're caloric dense, or a lot of calories in a small amount.
Correct.
So on occasion, I do have a client, I think, that ate a whole bag of Blue Diamond family-sized almonds in one day. So that's just sheer volume. That's a significant amount of calories. So when it comes to that aspect, the calories do matter, because if you're taking in 5,000 calories
Right.
of...
But that's a little bit unusual, because one of the things that I like about fats, and I harp on this all the time, is that they're actually satiating.
Yeah, correct. So when I'm looking at combining proteins, fiber, and fat together, that helps keep you full for a longer period of time,
Right.
keeping you more satisfied, giving you more even energy throughout the day. When we tend to skip meals, or we tend to have a carbohydrate-heavy, low-fiber, low-protein meal, that's going to get digested rather quickly, and you're going to be hungry very, very soon.
Very quickly. I've talked about this before, but for those people who haven't heard me talk about it, there's a relationship in your body between insulin and sugar. And what happens basically is your sugar load goes up like this. Imagine this as a graph. Your sugar load goes up. Following it, you're going to see your insulin level go up. And because the insulin is produced by your pancreas to digest the sugar. But unfortunately, then as the insulin load goes up, the sugar level goes down, and then you get hungry, because insulin is promotes hunger.
Yes.
So you really have to be careful of that.
Yeah, again, the protein, fiber, and fat help slow down the digestion process, keeping insulin levels theoretically at a much lower level, and keeping the carbohydrate absorption, whatever was in that meal, at a much more even level for 1 to 2 hours.
Right. So that's what we're kind of talking about, is the glycemic index.
In a way, yes.
Yeah.
There's a glycemic index diet out there.
Yeah.
Some of my clients do follow that theme. Usually, one of the first things I pick on talking about glycemic index is the people that drink their calories. And I'm not talking just about alcohol, but I'm talking about soda, sweetened iced tea, juice, Gatorade, vitamin water, all those things, Monster energy drink. Those are a lot of added sugar, and it's very easy to digest, and will create an insulin response. And typically, I try to emphasize that your body is going to change that type of sugar quickly to fat, almost instantaneously.
Instantaneously.
Yeah, unless you're running a marathon.
Right, right. I was at the store the other day, and they had this massive sale on, you ever gone to the Price Chopper, and at the front there, they'll kind of,
The end aisle piece.
Yeah, the end aisle piece, and they had 3 12-packs of soda. I forget what it was, Pepsi products or Coke products, for $10.
Yeah.
And people were just literally chucking these things in their cart. And I think to myself, if we could get rid of one thing in this country, I'd love to get rid of sugar-sweetened beverages.
I fully agree with you on that one. Some of the biggest sale weekends are those soda sales, and people will bring in just a separate shopping cart just for soda. So the added sugar, and oftentimes we were talking about kids or teenagers, and some of them having fatty livers, can be predominantly attributed to added sugar, the drinking of the calories that these kids are drinking, Mountain Dew, things like that.
Yeah, I mean, I've seen in more than a handful of cases, young people in their mid-teens be diagnosed with adult type diabetes, not juvenile diabetes, but adult type diabetes, and I'm convinced it's because of their sugar-sweetened beverages, and they're kind of going to concomitant, the amount of weight they've gained as a consequence of it.
Yeah, yeah.
And I say sugar-sweetened beverages because I don't mean to pick on just soda. I do mean to pick on soda, but I don't mean to pick on just soda, because there's a lot of beverages out there that are sugar-sweetened.
Yeah, iced tea is one of those ones that people don't often associate that has a lot of added sugar, but sweetened iced tea certainly is one. Energy drinks are
Energy
kind of
drinks,
one.
Gatorades,
Yeah, Gatorade and Powerade and vitamin water.
sports drinks.
Correct. They've done a great job marketing.
They have. Wonderful. And I also talk about juice, because juice is one of those things, like people, I had this one guy, and he couldn't figure out his sugars because he'd been trying so hard and blah, blah, blah. And it all came down to the fact that he was just chugging orange juice.
Yeah.
Because he thinks it's healthy.
Yeah. So, yes. So orange juice does have some calcium, some vitamin D, some other things, but really it doesn't outweigh the negative effects of the sugar.
Absolutely not. In fact, what I tell patients is that I say, if you're a diabetic, you should have orange juice on hand in case you have a sugar shock or low sugar.
Yeah.
Because there's nothing better at pumping up your sugar quickly than orange juice.
Yes, correct.
Or any kind of drinkable, sugar sweetened beverage. I said, but you're using those just in case of sugar shock, not as part of your diet.
Right. Yeah, you can get a lot more nutrition in a handful of blueberries than you can from a thing of cranberry juice or orange juice.
Yeah. So let's talk about berries. And I say this, the people that know me will get a laugh out of this because I am a berry fanatic. I grow all kinds of berries. We buy berries all year long. My blueberry bushes now are just piled with blueberries, so it's a great time of year for me. Let's talk about the health benefits of berries, because it kind of a segue to my next kind of topic, and that is trying to prevent cancer. Obviously, if you're trying to live well or age successfully, you want to prevent cancer if you can. So let's talk about cancer prevention in terms of diet in general, and try to mention a little bit about berries, just because I love them and I want to continue to eat them.
Yeah. So oftentimes, one of the phrases I'll use with clients is you want to eat a rainbow of colors each week. So when you go grocery shopping, I try to buy a rainbow of colors. I think about what I bought last week and then change up the color of what I'm buying for this week. And so that includes all fruits and vegetables. And then specifically when we talk about berries, all those things have very high antioxidants properties. And pretty much cancer you can attribute to, cancer is DNA damage caused to a cell that causes it to replicate into something we don't want it to, cancer. And eating fruits and vegetables and berries can prevent that. And so the more berries we eat, raspberries, blueberries, strawberries, blackberries, the greater chance we have of not having cancer. And it also reduces, again, inflammation in the body. And it's a very low carbohydrate food for the amount of portion size that you can eat. Right. I think I've only had one person ever overeat fruit in my counseling of 10 years or so. Yeah,
I always tell people, sometimes people come in and they're big fruit people and their sugars are coming up kind of thing. And I'll say, listen, fruit is definitely healthy for the person without sugar. I said, but if you've got sugar, sometimes you may have to limit your amount of fruit, but not specifically raspberries, blackberries, and blueberries.
Yeah.
Strawberries are a little higher in sugar.
Yes, they are.
Yeah.
Yep. So yeah, with the blueberries, raspberries, and blackberries, and other kind of similar berries, I try to emphasize having that. It can be easy to add to almost anything, whether it's breakfast or lunch or dinner.
Or dinner.
Added to any kind
Throw blueberries in your salad.
Yeah, exactly.
Yeah.
It can be added easily to any kind of entree or.
Yeah. And one of the problems about berries is, my daughter goes away to school, and she loves to come home and eat berries. But when she's at school, they don't serve a lot of fresh berries.
Yeah.
And there's a reason why, because they're expensive.
Yes, correct. Yeah. So whether it's organic or non-organic, berries do tend to get expensive.
Yeah.
Sometimes people don't buy berries because they can't afford the organic berries, but I'll still have people buy non-organic berries because I think the benefit of the berry outweighs.
Right. So talk about frozen berries, because they're probably cheaper.
Yeah, so frozen berries can be very economical to purchase.
Yeah.
And so that can also be added to a lot of different things.
Correct.
And so that's a useful, and then plus, fresh fruit tends to go bad within a week. It doesn't last much beyond a week, but frozen berries can last quite a while, and you can add them to anything.
You can, and you chuck them in your freezer, and they're there when you need them.
Yep.
We're a smoothie family. We tend to make a lot of smoothies.
Yep. So yeah, smoothies are they've become more popular, but they've been around for 20, 25 years. But now in the last 5, they've become a lot more popular.
Oh, they have.
So people use berries as a basis, bananas or avocados now are being sold, diced up, frozen that you can have. Kale is a popular one. Eat more kale, as the bumper sticker says.
Yeah.
I just
wish I liked it more.
The kale?
Yes.
Oh, well, there's over 100 plus different types of kale.
Right, and none of them are any good.
So some of them can be quite fibrous.
Yeah.
But bitter. Yes.
Yeah. We grow kale and we eat it.
Yeah. It's a pretty hardy thing to grow.
Yeah, it's a wonderful thing to grow. I want to say that we harvested our kale last year in January with we unearthed the snow from it and ate kale. And that's one of the things I'll tell people. I would literally eat kale even though I don't love it because I know it's so good for you, kind of thing.
Yeah, sometimes when I'm counseling patients and they have...
And that dark green color.
Yeah, so the dark green color, the darker the vegetable, has more vitamins and minerals.
Correct.
Greater amounts of fiber. So really they're the healthiest. So
Right.
kale, spinach, broccoli, Brussels sprouts.
As opposed to like iceberg lettuce.
Yeah, there isn't much nutrition value to iceberg lettuce.
Right, and I want to go back and tell my mother that for the 60 years she's forced iceberg lettuce on us. Mom, there's no nutrition in this.
Yeah,
But that's what we used to eat.
Yes, yeah, I still can't. My 96-year-old grandmother is still alive, still serves me iceberg lettuce salad.
Yeah.
So can't get her to change just yet.
Yeah, but I have noticed actually a big kind of a sea change in when you go out to restaurants and stuff like that. They are serving these healthier varieties of greens and stuff like that.
Yeah, so yeah, much more color and darker versions of salad.
Yeah. So we talked about sleep in our warm-up session. So let's talk about sleep. Are there because sleep is important to people at any age, and there's all kinds of studies that show better sleep is associated with better performance, better quality of life, longer lives, all these things. So are there dietary issues that we can kind of focus on that will help us with our sleep?
Yeah, every person that I counsel for the first time, I'm always asking about how their sleep is. So whether they're just talking to me about healthy eating in general or weight loss, whatever it might be. Things that influence our sleep, well, I should start with poor sleep is associated with weight gain or keeping you from losing weight.
Right.
So
You just don't feel like you have the energy to do anything.
Yeah, and then it potentially will increase a hormone in your body that stimulates appetite.
Correct.
So you'll be fighting against a hormone in your body telling you to eat.
And the other thing I find is that people that don't sleep well, they try to jumpstart themselves with sugar.
Yes, so their energy levels will keep going up and down.
Up and down, yeah.
And so the things I'll focus on is weight loss will help if they have a lot of intra-abdominal obesity. That pushes up on their lungs and they have a hard time breathing at night. Potentially if they have sleep apnea, that can affect their sleep. And so weight loss can help decrease intra-abdominal fat and then maybe help with their sleep, their breathing. The other things I look at, though, are typically caffeine consumption. So if you're drinking coffee or having a Pepsi or an energy drink late in the day, that can certainly disrupt your sleep patterns that night.
Yeah. My general rule for people is for people with sleep problems. Now, some people can drink. My father-in-law drinks coffee at dinner and goes right to bed. But for people who are having sleep issues, I tell them to keep their coffee caffeine all prior to noon.
Yeah, that's a general rule of thumb that I use as well.
Yeah.
And I see if that helps at all with sleep.
But you're saying that some people are even more sensitive to caffeine.
Yeah, so we used to think or thought that caffeine got out of your system within 6 hours or 8 hours, but we find with some people, not all, that even 1 cup of coffee in the morning can disrupt sleep patterns that night.
Wow. So if you are having sleep issues, you may want to just cut out caffeine entirely.
Potentially to see if it helps alleviate some of those challenges, because I'd rather you do that than, let's say, prescribe a medication or something along those lines when I have a dietary fix.
Right. And one of the other issues I talk about with diet and sleep is alcohol. This is a tough one for people because some people get into this habit of a nightcap.
Yes.
So what are your thoughts on a nightcap?
So oftentimes majority of us perceive alcohol as helping us get to sleep. It helps us quiet our mind for our anxiety, reduce stress potentially. But in reality, it's actually disrupting sleep patterns.
It is. It's a central nervous system activator.
Yes, so it's not allowing you to get into proper REM sleep, and so it actually is causing you to have poor quality sleep, which could be leading to why you're stressed again the next day, and then there's a vicious cycle of keeping using alcohol to help you.
It is.
And so oftentimes I'll talk about alcohol, and that could be an empty calorie that people are drinking. And usually people are drinking a lot more than they think they are. So when we go back to the food journaling and I have somebody perceive of how much beer did I drink over this past month, it might add up to something significant. So people often underestimate or overestimate what they're actually doing.
Especially with hard liquor. I once had a patient and I'd taken care of this guy for years, and one day he comes in and we go over his labs, and his liver function tests were just horrible. And it came out of the blue kind of thing. And he'd always told me he had 1 drink a night. And so when we went back and kind of deconstructed that drink, he actually was putting 9 shots of rum into this big cup with ice and then
Yeah.
some Coke in there. And I don't think he was purposely misleading me. I think this was just something he kind of evolved over time. 9 shots of rum.
Yeah.
And so people do drink. I don't think they realize.
Yeah, oftentimes they're underestimating what they think they're doing.
Right.
And moderation becomes kind of people's definition of moderation can be very different.
Yeah. Is there an amount of alcohol that you recommend?
That's a great question. With a Mediterranean-themed diet or with the Blue Zone way of eating, like one glass of wine a day seems to have some beneficial properties to it, but that can be a slippery slope.
It can.
So it can be your definition of what is one glass of wine, and I think a glass of wine, the amount is much smaller than we think it is. So sometimes people are
It's
often...
not 16 ounces.
Yeah, it's not 16 ounces or half of a bottle or a bottle.
Yeah.
And so sometimes people don't realize that all of a sudden now they were drinking a bottle of wine a night,
Yeah.
and they didn't realize it. And
Yeah,
so-
I had this guy one time, and he says to me, Doc, I'm kind of disappointed in you. And I said, well, why? I said, there could be a lot of reasons he's disappointed in me, but I was interested in his approach. He goes, you haven't recommended I have a glass of wine a night. And I said, I don't ever recommend alcohol because I don't know that you don't have some type of genetic predisposition to alcoholism, that I could kind of just get started by one glass a night. I said, and the other thing is, if you're drinking a glass of wine a night, even if it's one glass of wine, a very minimal amount, certainly well within the bounds of anyone's definition of moderation, there's a psychological dependency to that bothers me.
Yeah.
And that is that, how do we know that that's not going to become 2 or 3 or 4? And it often does.
Yep.
So when I'm counseling people on alcohol, I'm like, listen, you want to have 1 to 2 drinks a night, that's fine. I think that's fine. But I want you to do it 3 or 4 nights a week. You want to take at least 2 to 3 nights off a week, every week.
Yeah, oftentimes during the counseling session, I'll say that is on my list to address. I'm not going to ignore it moving forward. But it might be problematic in the future as far as explain why you're not losing weight or your liver still has issues.
Correct. So we only have a couple minutes left. I wanted to talk about strength and muscle mass as people get older, because I always talk to people about how important it is to keep up your strength as you get older, because we do tend to lose muscle mass as we get older.
Yes.
So how can the person who's aging, how can they dietarily focus on keeping up their strength?
So protein is kind of the basis for our muscle and our immune system. And so the kind of conundrum is, as we get older, our protein requirements theoretically go up. But oftentimes when I'm counseling a little old lady, she doesn't have a craving for meat anymore. But you are trying to get in protein. So whether that's lean protein, so to me, any kind of meat. So it's beef, chicken, turkey, pork, fish, elk, that's protein. But
Emu.
Emu, yes. And then other sources of protein are eggs, Greek yogurt, cottage cheese, nuts and seeds, beans, which we haven't talked about quite yet, or lentils, which aren't often eaten in our culture, are great sources of protein.
Except by my family, we love lentils.
Yeah, so, and they're very inexpensive, so that's another benefit to them. But those are all sources of protein.
But let me ask you a question, though. When you're looking at the density of protein in food sources, comparing something against, let's say, a steak, which is probably the gold standard of protein, versus a lentil. I mean, what difference are we talking here?
Not as much as you might think.
Really?
So a deck of cards or the palm of your hand of meat, of steak or fish, is about 20 to 25 grams of protein. And so with lentils in a serving, you're going to be getting 10 to 15 grams of protein. So it's not too far off.
It's not too far off.
No.
And there's fiber in the lentils as well.
Yeah, there's a lot of other nutrition in lentils that's fabulous.
Aaron, I couldn't thank you enough for this discussion. One of the reasons I love having guests on is, number one, I enjoy the conversation, but number two, I learned stuff, and that was a great conversation. As much as I thought I knew about diet, you've actually helped me quite a bit.
Oh, good.
Thanks again to Aaron Jones, a registered dietitian at Rutland Hospital. Thank you for tuning in. It was great to have you. Please join us for our next program, where we're going to talk about part 4 on successful aging. It's going to be a surprise episode. Please tune in. Cheers.